Okay, to start phase 3 of the hip arthroscopy, next we would start going into some more strengthening and standing or closed kinetic chain strengthening. So what I'm going to have her do next is actually she's going to do some hip movements with resistance of the band. So standing there, we're going to work on those glute med muscles again. So she's just going to stand and bring that leg straight out to the side. Hold for just a second and then bring it back. The biggest thing that we watch for here is to make sure that she's only using the hip muscle to strengthen that leg, and she's not compensating by leaning her body over. And then she's using the upper body weight taken away from that lower leg. After she's finished with about 20 of those, she's going to do a very similar motion coming straight back to work on the glutes a little bit more. Same thing, we're going to watch for any compensation of leaning forward, where she's using the upper body weight to pull that leg back. So she would do about 20 of these, holding for a couple seconds on each one. Next, we're going to move to the front of the hip, and we're going to do a resisted hip march. So she's going to stand on that band, and then she's going to bring the left leg up. Hold for just a second to get a good contraction on those hip flexors. It's a little bit harder to compensate on this one, just because of the motion itself. So not a lot to watch out for on that one, but she would do about 20 of these again. Next, we would start working on returning to doing some squats. So we would just start with a mini squat to begin with. So standing next to the table, I'm just going to ask Emily to squat back like she's going to sit in a chair. So the big thing to watch out for here is that she's not sending the knees too far over the toes, and she's keeping all of her weight in her foot evenly. She's not lifting the heels, and she's not lifting the toes either. She would just hold for a second or two and then back up. We would start with just about a quarter motion, a quarter squat motion, until she's comfortable in that hip to return to a deeper squat a few weeks later on. So she would do about 20 of these. Next, we would probably start working on some strengthening of all of her balance muscles. So we would eventually like to progress to standing on an unsteady surface, but to start with, we would do things just like single leg stance, or to get her to get used to putting weight back through that hip. And we would usually time her for about 30 seconds and do 2 to 3 of these at a time. Also, we could do things such as a tandem balance, like she just showed you. We would alternate one foot in front of the other for about 30 seconds each, a few times each. Once she's gotten a little bit more proficient in that, we would go back to doing all of that again, but on an unsteady surface such as the foam. We would do all of those a few times, 30 seconds to a minute each. As she begins to progress with those, we'll start to turn that into a dynamic movement, either with her doing exercises on an unsteady surface, or even putting in an outside force to make her keep her balance. After that, I would like to show you some hamstring strengthening that she could start doing, which are stool scoots. So she would just go a specific length at the gym, just pulling herself forward using that hamstring, just to build some of those muscles back up. We can also make this resisted by putting a band around as she gets a little stronger with that, to give her more weight to have to pull. She can also do backwards pushes just like she's doing there to work on increased quad strength.